More Americans died from coronavirus on Wednesday than during the September 11th terrorist attacks. Even with this positive vaccine news that we've been receiving, CDC Director Robert Redfield saying that the daily death toll will remain near 3,000 for the next 2 to 3 months. Let's bring in Robinson Meyer, who is the staff writer at The Atlantic and co-founder of the COVID Tracking Project. Jarring numbers, Robinson, and at the COVID Tracking Project, you track the trends of the pandemic, testing, cases, and the number of deaths as well. Was this surge in deaths something that you were unfortunately anticipating?
Yeah, unfortunately it was, and really there's almost two surges that we're kind of tracking right now. The first is that data collection on basically every front except hospitalization slowed down over the Thanksgiving break. And because there was a surge in cases and a surge in hospitalizations and just infection before Thanksgiving, we expected a lot of numbers to kind of fall and then immediately decrease, basically as people who died over the Thanksgiving weekend were processed through the system. And then that creates its own delays and just creates a kind of a surge that we expected. On top of that, we knew that a lot more people were getting sick, so we expected the numbers to go up anyway. I think the third surge that we're kind of looking for right now is, as it feels awful to talk about it in these terms, but the third surge that we're looking for right now is that we also know that probably many people were infected at the end of November, and many people were infected over Thanksgiving. And those cases will just start to show up in the next few days. They'll start to show up in the hospital totals in the next day or the next week. And then they'll of course start to show up in the death totals soon after that. So really, in some ways, it's still hard to tell whether the surge in deaths that we're seeing right now, how much of it is increased infection. I mean, we know that a lot of it is increased infection, but some of it may be just we're catching up to people who died several weeks ago and are just being processed now, in addition to a kind of underlying surge in the number of deaths.
Before we go any further in this conversation, of course, it's so important to note that these are more than just numbers that we're tracking in this broader coronavirus pandemic. For every number, for every statistic, there's a story, there's a life that's behind it, and a family that's been disrupted in one way or the other. And with all that in mind, I wonder if, based on what you've seen in these numbers so far, if citizens are becoming numb to numbers themselves, and if the numbers are going far enough to actually show and paint a picture of just the type of damage that we are seeing to a healthcare system, to an economy as well, but just to the fabric of human life as we know it in society more broadly.
I think people are. I think you have to, every day you have to think about those numbers, and we do this at the COVID Tracking Project, but you have to think about how each of those numbers, I think on average a COVID-19 victim leaves 9 people behind. That's 9 grieving people, in addition to, of course, someone losing their life. I mean, someone losing the most important thing to them. I think at the project, we talk about chart fatigue. I mean, we publish a lot of charts. We try to help people understand what's happening. At the same time, the pandemic has been awful for the past month or so. It seems like it's going to be awful for the next month. And there has not been the same sort of policy response that we saw in the spring. And one reason for that may be that people just are struggling to process the numbers, or struggling to respond to the risks in the same way that they were earlier. Sure. One way we think about this is that in the US, during a normal year, I think about 7,800 or 7,000 people die every day, just of all causes. So for COVID-19 is now killing 3,000 Americans a day about, we're bumping the number. Think about what a boost that is to the amount of mortality in the country already. We've
right.
nearly increased the number of deaths in the country by 40 or 50% every day. So
certainly,
it's just a stirring number.
And Robinson, I asked that question not to take anything away at all from the work that you and your team are doing, because it's amazingly important, and to understand the numbers is to truly to understand the impact in so many different ways. And there have been institutions, whether they be business focused or whether they be political offices, that have stepped away from the numbers and quite frankly, we've seen what kind of destruction, further destruction that causes when we're not paying attention to statistics and understanding exactly the impact of them as well. And so how much are the coronavirus cases, the surges, the deaths, hospitalizations, underscoring the need for a vaccine, which we've heard more about over the recent weeks as well?
Yeah, absolutely. I mean, a vaccine can't come soon enough. And any kind of way we have of boosting immunity and getting people protective immunity, especially in the short term, really can't come soon enough. You know, one way that I've been thinking about this is the treaty to end World War I, the armistice, was signed at 5:45 a.m. That actually didn't go into effect until 11 a.m. I think 2,500 people died in fighting in that 6 hours. And they're seen historically as enormously tragic, needless deaths. Well, right now, 3,000 people are dying every day. And we know that we are going to be able to stop people dying in 1 or 2 months. That in 1 or 2 months, we're going to be able to just really knock a lot of this mortality down, because we'll be able to have it inoculated so much of the people who are most affected by this virus. So we're in this period of needless deaths right now. And a vaccine just really can't come soon enough. And in some ways, we should be increasing the lockdowns or the public health measures that we're taking, because we only have to kick the can down the road for another six or 8 weeks before we're able to really knock down mortality from this virus.
Robinson, while we have you, I did just want to make sure we get this question in. Since early March, the COVID tracking project has become an important authoritative source for virus statistics in the U.S. Why was it so important to start this, and what would you give to in terms of other states out there that have stepped away from consistent publishing of data for their residents? What message would you give to them?
Well, so we do draw on state data. You know, all the data that we publish is directly from states, and we work directly with states. I'd say where we see the failure is from the federal government. The federal government should have been publishing testing statistics, as well as a number of other statistics from the beginning of the pandemic. And in fact, in late February, the federal government stopped basically tracking testing in a public way, and that's why we founded the COVID tracking project. We went and got all that data from states, started publishing it in a streamlined way online. At this point, what we need is for the federal government to publish a lot of the data that we're using, what we want to do is hand off basically this responsibility to the federal government. We think this should be a government task all along. It's something that the public deserves.
Understood.
And so we're hopeful that in the next 6 months that the government will kind of take back over some of these capabilities that we started doing on a volunteer basis in March.
Certainly. Robinson Meyer, who is the staff writer at The Atlantic and co-founder of the COVID Tracking Project. Thanks so much for the time, Robinson. We appreciate you and your team's work on this.